I'm Jerry Hesch, orthopedic manual physical therapist, meaning I treat joints, and I work at Hesch Institute in Aurora, Colorado. And my client, Samantha, is diagnosed with sacroiliac joint pain, and she had therapy. Am I correct? You had physical therapy?
Yes.
Yeah. And it helped a little bit, but when it was over, then she reverted. Saw an orthopedist who proposed injection and suggested that an SI fusion might be in order. And pain is left-sided in the area of your SI.
Mm-hmm.
This is the area?
Yes.
Okay. And what I find is that all of her pelvic mobility tests through the hemipelvis are normal. I can create superior spring mobility. I can create inferior. I can create anterior. I can spring the ilium into forward rotation and inferior glide, and that's equal on both sides. When I come to the sacrum, I notice that it's prominent on the left lower quadrant, okay? So the sacrum is like an upside down triangle, okay? And then if you draw a line down the middle and a line across at the bumps on the ilium called the PSIS, then you have an upper and lower sacral quadrant, okay? And I'll overlay the anatomy here. So here is her sacrum, this triangle-shaped bone. And it's lower on the left side, and I can't spring it up on the left. And the lower quadrant on the left is more prominent, and I cannot spring it. Okay, so I'll show you the spring mobility. So here is rotation, side bending, pushing up on the right side. And then on the left, I cannot take up the movement because it is stuck. And if I double that force and even increase it beyond that, there's no movement. If I do a spring on the right lower quadrant, you can see that I can load it and I can spring it, and it bounces forward and recoils backwards. I come on the left lower sacrum, there's no spring, it's stuck. And this is with a reasonable amount of force, and I'm even doubling that force, and there's still no movement. And if we go to the upper quadrant, we have spring mobility on the right, and we have spring mobility on the left. Now the body always compensates for an imposed asymmetry. And the place where the body compensates for a sacral torsion is in the upper back on the left side. And basically, the rib cage rotates to the right in the upper thoracic. And so I'm springing rib number 6, approximately, rib number 5, rib number 4 does not spring. There's no movement there. And then I come up to what I believe to be number 3, and I can spring that. This is driven by the nervous system, and it's a muscular problem, and this will release automatically when we release the sacral torsion. I wrote a book chapter on sacral torsion, and it is in the book called Dynamic Body by Eric Dalton, and you can find that book chapter on my website. Just go to heschinstitute.com, and it's spelled H-E S like Sam, C-H, institute.com, and then go to the search box on the upper right and just type in Sacral Torsion chapter. Okay? Now I'm going to film myself doing the self-treatment, and Samantha, you can sit up and watch me. And the self-treatment is very effective. I could mobilize her sacrum with my hands, but I'm just going to teach her how to do it herself. And I use a piece of 2-inch foam. It's 2 by 4 by 8. But you can roll up a towel firmly and tape it, or use rubber bands, so about an 8-inch length. I find the tailbone. Then I put this right above so that it's on the lower part of the sacrum. My feet are wide as my shoulder and the heels are 4 inches forward. All I do is touch the wall with my shoulder and I bend forward in the hips and I bring my nose in front of my toes. It's a very small range. Okay? And I do 10 of these. And I would do this twice a day for a week.
Okay.
And then after that, do it about twice a week. Okay?
Mm-hmm.
And that's the self-treatment for torsion. So let's go ahead and have you come do that.
Okay.
You put this side against your back, or
The round part.
Yeah.
The round part. Right above the tailbone. Good. Feet are as wide as your shoulders. Heels are 4 inches forward. And you just bend forward. Nose in front of toes. Bend back and touch the wall with your shoulder blade. Good. Do 10 of those.
Right?
Nice. Come lay on your stomach.
All right.
I can now take up the slack, pushing the sacrum into side bending. I'm under the left lower part of the sacrum called the inferior lateral angle, or ILA. And I can take up the slack and then I can spring it and I see her upper body move. So motion is translating through that. And now this lower left quadrant of the sacrum is no longer prominent. And I can take up the slack on it. I see her feet bob every time I spring it. And you can see that I can now spring it and it thrusts forward and it bounces back. So we have restored motion through the sacrum. So that is the self-treatment for the sacrum. And I'll show you the mobility of the rib. So this is probably rib number 6 down here, inside the scapula. That would make this 5. That would make this 4. And that would make this 3. And then 2. And then 1 is deep in the trap muscle. So now that motion is restored. Do you want to step down and walk down the hall, see how you feel?
Sure. Yeah, it feels better.
So it feels better?
Mm-hmm.
Nice. And then go ahead and sit in this chair.
Okay.
And I don't know, did you have any pain sitting?
Not really.
Yeah. Did you feel at all uneven sitting?
I did before.
Okay.
Yeah.
Okay. How do you feel now?
Definitely a bit more level.
Nice.
Yeah.
Nice. So this is a one-time visit.
What the heck?
You know what you need to know to keep that torsion resolved.
Yeah.
Okay? So I'll stop filming here and then I'll take a look at your neck. Thanks for letting me use you.
Definitely.